Live. Hi, folks. I'm here with Dr. David Brownstein, as you can see. Unfortunately, I can't speak in Portuguese now. We are just make this live in English. But afterwards, I'm going to translate it for you, okay? Don't you worry, não se preocupem que depois vou traduzir para português, tá bom, gente? So let's do it. Dr. David Brownstein, I am so honored to be here with you. I know you're very, very busy because you're one of the doctors that have an amazing knowledge about iodine. And I appreciate a lot you're here with us to share your knowledge with my audience.
Thank you, Fernanda. I'm happy to be here. I wish I could speak Portuguese to everybody.
Oh, no problem. Portuguese is a very hard language. Even us, we have some difficulties talking in Portuguese sometimes. The grammar is very confusing. Thank you, Dr. David Brownstein. Let's start it. So I was talking to you how I changed my life with iodine. In the beginning of this year, I read your book, which is here on my Kindle. And I read it on the flight to Brazil. And I was shocked when I read it because I had started taking Lugol's after a video of Judy Chu that showed your protocol. On this video, you had been with her. And I started to do the protocol before reading your book. And then I started to feel something amazing because I was very, very energetic. And I had Hashimoto's, I had hypothyroidism, and suddenly I had an amazing energy that it was a surprise for me. And when I read the book, it was so obvious that I couldn't believe how could actual medicine, today medicine, don't know about anything that was in your book. I thought I had to spread this to the world, and I would do. And that's what I'm doing. And that's why I invited you to come here, talk to me.
I'm happy to be here.
Because we have to spread this information. Dr. David Brownstein, tell me something. Is current iodine intake of population is enough for health, for whole health, or just to avoid goiter? How is your vision about this?
Well, every cell in the body needs and requires iodine to function optimally. The RDA, in the U.S., we talk about the RDA, the daily requirement for iodine, and the RDA. You guys have different names for the same thing, the daily.
Yes, the RDA is the intake we take every day of something.
So the RDA was established by the U.S. government in the early 1920s to prevent the minimal amount of a nutrient necessary to prevent a disease. So the RDA for vitamin C is, I believe, around 70 milligrams, and the RDA for that was set to prevent scurvy. Now,
yes,
that 70 milligrams may prevent scurvy, but is that the optimal amount for the rest of the body? And the answer is no. Every cell in the body needs and requires vitamin C as well as iodine. So the RDA for iodine was set in the 1920s in the US to prevent goiter. Goiter is a swollen thyroid. The thyroid gland sits here in the lower part of the neck. And in the turn of the 20th century, across the United States, and particularly in the area where I live in the middle of the United States, there was an epidemic of goiter, and it was occurring everywhere. And, men were having goiter, women were having goiter. Women were more affected than men because women have a higher iodine requirement, which we'll talk about. And the animals that were being raised in farms were suffering from thyroid problems. They weren't growing correctly. So through a variety of studies on farm animals near where I live, there was a researcher who was tasked by the U.S. government to determine what's the minimal amount of iodine to stop the thyroid problems in animals, because the animals weren't growing to the right size. They weren't procreating correctly. They weren't having babies like they should. And there was a worry that as the U.S. population expanded across the continent, that the human body supply would outstrip the farm animal supply. The worry was we weren't going to be able to feed the population because the farm animals weren't growing to the right size and they weren't procreating correctly. So a researcher in an area right near where I live was tasked with adding different amounts of iodine to the animal feed and seeing when the animal's thyroid problems went away, the minimal amount. And from that, what he did was when he added the iodine to the animal food, the animals now started procreating correctly, growing to the right size, and their thyroid problems went away. And he, from the minimal amount of iodine needed at the animal feed, he just calculated the amount humans would need from the body weight. And so the RDA was established at that time for 150 micrograms per day.
Yes, it's very little, a small dose. That
150 micrograms, that RDA for iodine, was never established to be the optimal amount of iodine for the human body.
Yes.
It was the minimal amount of iodine needed to prevent goiter in humans.
Yes.
It's really, in animals, but they in humans. And this minimal amount of iodine did its job back then. The goiter epidemic went away, and it's still used today, over 100 years later. But now our need for iodine has skyrocketed compared to our predecessor.
Yes, because of halides that are very abundant on our system.
So iodine's, as you mentioned, iodine's part of the halide family in the periodic table, group 17.
Yes.
The halides are a group of elements that have similar structure and similar function. And the halides, in order of size of them, are fluoride, chloride, bromide, and iodine. Those are the four major halides.
Yes.
And of those four halides, 2 are essential for the human body, and 2 are non-essential toxic elements for the human body. The essential ones are chloride and iodine. The non-essential ones are bromide and fluoride. What's happened over the 100 years since the iodine was established is, in all Western countries, our exposure to the toxic halides, fluoride and bromide, have skyrocketed.
Yes, the contamination has skyrocketed.
And these things competitively inhibit iodine in the human body. So what that means is if you have too much bromide or fluoride, it's going to push iodine and chloride out of the body. And it's made our iodine deficiency epidemic worse. So our needs for iodine in our population in our Western world right now are much higher than our predecessors were. And we're suffering the effects of this. And we're suffering the effects of this where iodine concentrates in the human body. The highest concentration of iodine is in the thyroid gland. The next highest concentrations in the breast or the ovaries, depending on the studies they look at. But it's all the glandular tissue that concentrates iodine against the gradient. Thyroid, ovaries, uterus, breast, prostate, and pancreas.
And also skin.
And skin as well. But this is where we're having all our problems. And we have thyroid cancer in the U.S., the fastest growing cancer. We have 1 in 7 women with breast cancer. I know in Europe, the numbers are very similar.
Yes, you're talking about cancer. It's a very, very important issue because people don't know. There is this book you must know, of course, Breast Cancer and Iodine. It's amazing because this Dr. David Berry tells us that cancer is caused by lack of iodine deficiency. And the spread of the cancer is caused by T3 deficiency, because connective tissue isn't strong enough to hold the cancer just in the same organ and starts to be more vulnerable, and the cancer spreads easily because of lack of T3. So everyone, I always ask people to measure their basal temperature, and it's always lower than the ideal temperature. And what I see now is that we are living in an epidemic of hypothyroidism. It's overwhelming. Do you see this in your clinic?
It's the same thing. And yes, I see it. And it's a mess. And, we've got the Western world is very sick right now. And either we fix these problems or we'll just continue to suffer the ravages of iodine deficiency, which is problems with the breast, ovaries, uterus, prostate, pancreas, and thyroid.
Yes.
Skin, same thing. The skin holds 20% of the body's iodine.
Yes, my skin, my texture of my skin is completely different. It used to be a crackled, so dry it was. Now it's very soft. My skin is very soft now, very different. This book, I have this, your book too. This book is amazing. The beginning of the book is it was a shock for me when I saw that cardiovascular disease also is a problem of hypothyroidism.
So that's been written about for over 100 years in Western medicine. It's well known that hypothyroidism or an underactive thyroid leads to hypercholesterolemia or high cholesterol levels, can lead to plaques and blockages, and that's, in conventional medicine, they treat it with statin drugs and other things that don't treat the underlying cause of the problem. Many times it's just correcting the hypothyroidism, which in many cases corrects with iodine and some other nutrients that the thyroid gland needs.
Yes. Also fibromyalgia too.
Absolutely.
It used to be a form of a way to diagnose hypothyroidism. Now doctors even know they don't know that it's just caused by hypothyroidism.
Absolutely. They don't really learn it in medical school. They learn that how to prescribe drugs, not treat the underlying cause of the problem.
One problem we have, not just one, two, because the doctors the regular doctors, the patient gets there starting to use Lugol's, and the TSH rises, and the Hersheimer reactions, and the doctor frightens the patient. Oh, your TSH is very, very high. You're losing your thyroid, and you're having these reactions. You're destroying your thyroid. It's very difficult. That's why my course, I try to teach all these details to people, so that this kind of doctors don't discourage them to continue using Lugol's, because TSH rises. And I would like you to explain my audience why TSH rises with Lugol's.
So when I teach doctors, how to appropriately utilize iodine, in that part of the lecture, I'll always stop and ask, what's the first thing you'll see on blood tests that could make you think you're causing a problem? And the answer is an elevated TSH occurs when you put someone on iodine who's been iodine deficient. The reason for that is that's the elevated TSH when someone goes on iodine for the first time and they've been iodine deficient is a normal and expected response. Yes. It lasts about 6 months, 3 to 6 months in most people, and then it resolves itself.
Yes.
The reason for it is iodine, whoever designed us realized or made iodine a very essential substance for the body. Every cell in the body needs and requires it. Iodine concentrates in the glandular tissue of the body. Mm-hmm. And the glandular tissue, as I said earlier, is the thyroid, the ovaries, the uterus, the breast, the prostate, and the pancreas. So the reason it concentrates in the glandular tissue is that's where you make all your hormones. You make thyroid hormone in the thyroid gland. You make ovarian hormones in the ovaries. You make pancreatic hormones in the pancreas. And iodine, you can't make any hormones in the human body without iodine.
Yes.
Now you can make irregular hormones if you're iodine deficient, but you can't make normal and the correct amounts of hormones without iodine. So to ensure that we can make hormones, because we can't live without hormones, our designer, our maker, designed us with an intricate mechanism to concentrate iodine from a low concentration, which is in the bloodstream, to a high concentration in the glandular tissue. So this is, you're moving iodine against the gradient where it's low in the bloodstream to it's high in the thyroid gland or high in the ovaries or, wherever.
It's different.
And there's a molecule called NIS, sodium iodine symporter.
Yes.
You can think about that like a little taxi cab that is waiting there for iodine to come into the blood. Iodine gets in the seat, and then that taxi cab drives it over the cell membrane and deposits it inside the thyroid or the ovaries, over the uterus or the breast. And then iodine is supposed to maintain a normal architecture of that glandular tissue.
Yes.
Well, for that taxi cab to move iodine across that cell membrane, you have to utilize a molecule of ATP or an energy molecule to do it. You also need a sodium molecule to help transport it over there too. So I always tell my patients, I'm always looking at their salt levels and ensuring that not only when I look at their iodine levels, I look at their salt levels as well, because most people are salt deficient. and they need
Yes.
adequate amounts of salt, which is the second major constituent in the human body. I wrote a whole book about this. And
Yes.
you
The
can't
next
utilize
one.
iodine without salt.
Yes.
So it
Yes.
all works together. And to stimulate those taxi cabs, that sodium iodine symporter, to move iodine from the bloodstream into the gland, you need TSH to do it, thyroid stimulating hormone. So the human body was not designed to have taxi cabs just waiting there with no passengers, no iodine. If you don't take iodine, those taxi cabs are going to go away. But once you start taking iodine, we have to manufacture more sodium iodine symporter, more taxi cabs. That's where TSH comes into play. It'll rise to signal to make those sodium iodine symporters. Once iodine resaturates the thyroid and the rest of the glandular tissue, then TSH will come back down and everything will be back into balance. But for the first 3 to 6 months, iodine levels can go up. TSH levels can go up and make
Yes.
people think they're having hypothyroidism or
Yes, they think it's because thyroid is suffering. It's is having is being shut down, and but I sometimes I see some people that their TSH don't rise. Is there any cause for that? Because I think it's weird because people are getting 8, 9, 10 drops of Lugol's with companion supplements.
TSH rises in the minority of patients. I make a point of talking about this because I don't need. There's a condition called iodine-induced hypothyroidism. It's in the literature, and it's one of the reasons doctors scare other doctors about taking or prescribing iodine or patients to take iodine. And what iodine-induced hypothyroidism is exactly what I just described to you.
Yes.
TSH will go up, and if you don't check the other thyroid hormone levels, T3 and T4, the active and inactive thyroid hormone levels, you're going to assume you've just made someone hypothyroid because their TSH is elevated.
Yeah.
However, if you put someone on iodine and you see them back and you talk to them and ask them, hey, how do you feel? They don't report feeling hypothyroid. They report feeling better.
Yes.
Their hair's better. Their skin's better. Their brain's better. Their energy's better, just like you were saying about yourself.
Yes.
And yes, the TSH may be elevated, but if you check the other thyroid hormone levels, T3, T4, reverse T3, thyroid antibodies, you don't see where everything's getting deranged. Everything's getting better. And T3 and T4, the inactive and active thyroid hormone levels, are usually just fine. So it's really not iodine-induced hypothyroidism. It's iodine-induced elevated TSH in order to make sodium iodine symporter. It's an expected outcome in putting people on iodine. Doesn't happen in everybody that you can see that, but it happens in enough that people need to know about
not
it.
With everybody. I thought it was with everybody. Mine TSH got to 24 the second month. I did labs, and it was very high. Then it was normal. 2 months later, it was like kind of 6. Then now it's 2, 3. It's okay.
That's how it goes in about 1/3 to 1/2 of people. Exactly your situation.
Oh, great. Very interesting. I would like you to say to my audience that there is no such thing as Wolff-Chaikoff disrupting or shutting down thyroid. Please, I'm very tired to say this, people, but you saying it is very different.
So this is part of the Wolff-Chaikoff effect, is this iodine-induced hypothyroidism. And what happens when someone takes iodine is if the thyroid gland's been really deficient in iodine and you all of a sudden start loading iodine into the thyroid gland, there can be a lag in time before thyroid hormone starts being made. So everything starts to look like it's hypothyroidism. T3 and T4 might be low. TSH might be normal. It might be a little bit high. But this low T3 and T4 is referred to as the Wolff-Chaikoff effect. And if you don't know what the Wolff-Chaikoff effect, it's got a fancy name to it. It's named after not one researcher, but 2 researchers, Wolff and Chaikoff. Yeah. And it sounds like it's really bad. You got the Wolff-Chaikoff effect, like you're in the ICU and 10 doctors are standing over you and they're writing down and they're diagnosing you. He's got Wolff-Chaikoff effect. So the Wolff-Chaikoff effect is basically iodine-induced hypothyroidism, a little bit different from what I said earlier. But it was discovered in rats. And they
Yes.
found when they loaded the rats with high doses of iodine, their thyroid stopped producing thyroid hormone. Now, that can be a problem because every cell in the body needs and requires thyroid hormone. We can't live without it. And if the thyroid all of a sudden stops making thyroid hormone, the heart's going to be in trouble, the kidneys will be in trouble, the liver will be in trouble, every cell, every organ in the body will be in trouble. Now, what they don't say about the Wolff-Chaikoff effect is it lasts about 24 to 72 hours at the upper limit. Then the body gets used to the newfound iodine that's in there, and it starts making thyroid hormone. And usually patients are asymptomatic. One of the ways you'll see this play out is in newborns. Once in a while, a pregnant mother will take iodine, and in the U.S., every newborn is checked for hypothyroidism. And so when they check the newborn for thyroid levels, a full term, no problem, newborn baby, the TSH will be 80 or 100. And it'll trigger the doctors to get a little bit.
Yes.
Yeah, because, this baby's been living off the mom's thyroid hormone while it's been in utero for the second and third trimesters. And now it's not making its own thyroid hormone. You can get cretinism and terrible neurologic problems from the baby not having enough thyroid hormone.
Yeah.
So this will trigger endocrinologists to put the babies on synthetic thyroid hormone, Synthroid or Levothyroid or something like that. Now we see a case of this about every 2 to 3 years in our practice. So I've been practicing over 30 years. So we've had maybe 15 of them, something between all of us, 10 to 15 cases of this. And every case has been the same. The baby's TSH is picked up as super high at birth. The endocrinologist puts that baby on synthetic thyroid hormone.
Yes.
And within 6 weeks to 2 months to 3 months, all of a sudden, thyroid comes to life. The baby produces enough thyroid hormone, they're able to come off the thyroid hormone. And the baby develops normally. Every time the baby has full normal development without consequence.
So it's a kind of upregulation system that protects us from producing too much hormone, from suddenly too much iodine in the system.
I think in these babies, it's an immature thyroid gland that's just not ready to do what it's supposed to do, and it needs a little bit of time in the real world. Now,
makes sense.
I have 7 partners. We see a lot of patients daily. We've been doing this for 35 years or so. We've seen 10 or so cases of this, 10 to 12 cases, something like that. It's not very common, but that can happen. That sort of parallels a little bit of this Wolff-Chaikoff effect. But these babies all develop normally. They're all off thyroid hormone.
Very interesting. I have a follower that is being seen with a doctor that made my course, that knows about iodine. And she's made in my protocol, your protocol, with eight drops. And she has Hashimoto's and Graves' disease. But now she is better from both autoimmune diseases, Hashimoto's and Graves too. Even Graves, she dropped from 19 to 12 her blood test, and Hashimoto's decreased a lot her antibodies. She's doing very well and feeling amazing in 4 months.
So the treatment for Graves' disease 100 years ago was iodine, and large doses of iodine. There's case history after case history after case history. When I lecture on it, I show these case histories. And that was the accepted treatment for it back in the day. Then all of a sudden, when, after World War II, when iodine was added to salt and into the food supply and goiter went away, doctors really had no interest in iodine. And, in the U.S., we treat Graves' disease with radioactive iodine. I would imagine you guys probably treat it the same way. It's not an expensive, it's an expensive treatment, but it doesn't cost a lot for doctors to do that treatment. And I have been practicing this way for over 3 decades. I've never had to send a patient for radioactive iodine. I see a lot of Graves patients. They respond very nicely to iodine as part of a holistic treatment regimen.
Yes.
And no matter what we're doing with iodine, whatever we're talking about, it always works better as part of a holistic treatment regimen where you're correcting other nutritional deficiencies, and
Yes.
you're emphasizing eating a good diet and drinking water and exercising and all the other stuff that goes along with it. But as far as Graves' disease goes, using iodine is a fabulous treatment for Graves' disease.
Yeah, I read this in iodine project in the articles of original internists. And you know, that's why I teach on on the protocol, the course I teach people. It's not just about Lugol's. You have to improve a little bit of your lifestyle, because sometimes people are eating very bad. They don't expose them to the sun, and they have many nutritional deficiencies that you have to correct before starting to use Lugol's, especially when you have autoimmune diseases like Graves. Graves, I just send them to the doctor. I ask them to not do the protocol by themselves. But Hashimoto's, for example, I used to see many people with low iron levels, and I think this is a main issue, because people start to take Lugol's with kind of very, very low iron levels, and this doesn't work. And I think that's why this bad name of Lugol's with Hashimoto's, because it really can worse if you take with low iron levels.
You bring up a super good point. And if you give somebody who's really low in iron iodine, you're increasing the body's metabolic rate.
Yes.
To increase the body's metabolic rate, you need iron to carry oxygen throughout all the tissues of the body. You need iron to supply the muscles with the right strength that it needs to do that. If there's no iron, you're going to enhance that metabolic problem, that lack of iron, and going to make and the situation could be worse. You're absolutely right on that.
Yes, and I ask people on my course, I put a kind of a rule that you can't have any drop of Lugol's if you are very iron deficient. You have to correct this first, because people sometimes, especially women with Hashimoto's, with heavy periods, they come with 2 of ferritin, 10. It's very, very low. And I ask them to correct this first, and then to start to correct all the nutrient deficiencies.
I like that.
Yeah, and it's working. I think that's why this bad fame, of Hashimoto's, because the doctors don't know all this stuff. That's why I asked you in the beginning of our life to teach the other doctors, because they don't know. And they just saw Lugol's without all this whole holistic view that you say in your book all the time. And they don't care about iron. They don't see the relationship between them, iron levels and iodine.
Absolutely.
Another thing too is vitamin D. So these nutrients, that's why it's called companion nutrients, because it's not just iodine just alone, because it speeds your metabolism. Tells us a little bit about it.
Well, so iodine in the thyroid gland, to make thyroid hormone, T4 and T3, the inactive and active thyroid hormone, the 4 and the 3 refer to how many atoms of iodine are attached to that thyroglobulin molecule. So to make T4 and T3, you need iodine to do that. If you don't have enough iodine, that'll lead to less production of that. But it's not only that, it's less adrenal hormone production, less ovarian hormone production, less testicular hormone production, all of them. So when you take iodine, the metabolic rate of the body starts to shift up, particularly with more thyroid and adrenal hormones coming on play. And if you're lacking iron, vitamin C, vitamin D, it doesn't, B vitamins, it's going to accentuate that problem. And in that case, if somebody gets worse, I don't use iodine separately, so I never used it as a standalone treatment.
It's some deficiency that it's not looking at.
It happens. Stop the iodine. Look for everything else out there. Correct that, and then start the iodine again. Usually, it works fine. And one of the ways I have people do that is sometimes if they're worse with iodine, I have them stop it and then take more salt. Salt's got a whole trace. Unrefined salt has a whole complement of minerals in it that the body needs. And
interesting.
Then I have them try the iodine again 2 weeks after starting the salt, and many times whatever symptoms they were having from iodine, negative symptoms, goes away. I wrote a book on that as well, Salt Your Way to Health.
Yes, it's the next one I will read. It's in my it's in my pile of books I have to read. Yes, it's not easy to buy books here from Europe because it's in the United States now. Even with Trump, is even difficult.
Right.
More difficult now. Yes. A question of a follower: if you know if iodine can help with renal cysts or some lumps in the gut, do you know?
So iodine deficiency causes cysts throughout the body, and so iodine shab in the glandular tissue is to promote the normal architecture of the glandular tissue. What that means is if it concentrates in the thyroid, ovaries, uterus, breast, prostate, and pancreas primarily, you want normal architecture of the thyroid or normal architecture of the breasts or the ovaries and uterus and pancreas and all that stuff. So if you have normal architecture, it's normal. The iodine deficiency continuum, and I'm looking for a pen. The iodine deficiency continuum, I can explain like this. If this represents normal iodine levels on the iodine deficiency continuum, theoretically you should have normal glandular tissue of the thyroid, ovaries, uterus, breast, prostate, pancreas. You don't have lumps, you don't have abnormal growths. It's just normal. It's a normal size here, it's a normal size here, normal pancreas, normal ovaries, testes, uterus, wherever that sodium iodine symporter is. An iodine deficiency in these glandular tissues, the first thing that happens is the tissue goes from being normal to cystic. And if the iodine deficiency goes on longer, you get more cysts in these tissues. And if it goes on long enough, the cysts become hard and nodular. And if it goes on long enough and you take a biopsy of those tissues, you get a hyperplastic appearance.
Yes.
Hyperplastic appearance under looking at it under a microscope. And the end of that continuum is cancer. Now, this has been shown in animal test tube and human studies. And what's also been shown in animal test tube and human studies is iodine can halt this progression and be able to reverse it. So I've seen many people with nodules and cysts in their thyroid, in the breasts, in the ovaries, in uterus, pancreas, prostate, who go on iodine and they can reverse that and return to normal tissue. Now, many people, when they get too large of growths, such as a huge goiter sticking out of the neck or big fibroid uterus sticking out, the woman's, lower pelvic area, taking iodine won't reverse this progression, but it will halt it. They won't get any bigger, but they'll be stuck in this position. Now, the younger you treat somebody with it, the better it is. I have a young man I started seeing at 16. I just saw him in the office in the last week or two. He's now 26 years old. When I saw him at 16, I saw him and his mother together, and she brought him in because he was going to have a thyroidectomy in 2 weeks for goiter. And he was all swollen in his thyroid. You could see it sticking out of his neck.
For goiter, should remove her thyroid because of goiter.
He was scheduled for surgery, and the mother wanted a second opinion. So I talked to her about iodine. She had my book on iodine. And I said to her, I gave her this continuum that I just showed you, cysts, nodules, hyperplasia, cancer. And I said, he's over here because his thing was so big. And I said, look, I'm not sure we can shrink this, but we should be able to stop further growth. But what he had going for him was he was 16 years old. He wasn't 56 years old or 66 years old. He was young. So we went on iodine, and his goiter immediately and gradually, but then went away. It wasn't immediate, but it was over about 6 months. And when I saw him back 2 weeks after starting iodine, the puffiness was better. He felt better. He got more energy, and his neck was bothering him because it was so swollen. And he said it was not bothering me anymore. It's like the irritation is out of it. And then I took pictures and I followed him over the next 6 to 9 months where it went down pretty much back to normal. He still had a little bit of a large one. And then being a teenager, he would go on and off his iodine just because he's a teenager. And when he'd go off it, he'd make an appointment, come in, he doesn't feel good. His neck would be swollen up again. And I'd say, you taking your iodine? No. Why? I don't know.
No.
So he goes back on iodine and would freak down.
Don't stop.
Now he's in his mid-20s. He's just married recently, and I still take a picture of him every time I see him. But his thyroid is totally normal. He never had the surgery. He feels good. He doesn't miss thyroid now that he's older and he's more mature with things. But I've treated many patients like him.
Dr. David Brownstein, I would like to ask you something that people are asking me here. Those diseases that comes due to estrogen dominance, like endometriosis, melasma, and do you think it can improve? Because in breasts, I know that iodine can lower the capture of estrogen, and the breasts gets amazing. In my group, people are with the breast soft. They don't feel hurt anymore. Don't hurt anymore.
I got a good story. Let me give you guys a good story with this one. This was a patient, Marion. She came to me. She was about late 30s, and she was a nurse, and she was scheduled for bilateral mastectomy 2 or 3 weeks from that visit. I said, "Why are you here?" I just don't want to get. I don't want to lose my breast, she said, and I don't know what else to do. I'm miserable. So her story was she developed fibrocystic breast disease in her early 20s, and it got worse and worse and worse and worse. Worse to the point where she couldn't wear a bra. She couldn't wear any tight-fitting clothes. She would just wear, the
and
what do you? I don't know what you call them.
Yeah. Just
very loose clothes
over her body.
Yeah, very tenting clothes. And anything that touched her breasts, she would make her cry. She couldn't bump into anything. She couldn't touch them. She couldn't, taking a shower was painful for her. The water hitting her breast was painful. So, I did my exam on her, and when I palpated her breast tissue, what I remember thinking back then was, it didn't feel like human tissue. It felt like a foreign alien thing in her body. And what it felt like to me was the punching bag tissue when I took Taekwondo in my younger days. The big blue bag you punch, felt like that with bumps.
Like sand, like
hard.
Sand, hard
plastic. That's what it felt. Hard plastic breasts. Like this. It didn't even feel normal to me. It didn't feel anything close to normal. And so she was receiving care at the University of Michigan Fibrocystic Breast Center. University of Michigan's a national hospital system, and she was seeing the chairman of the department. And over the 10 years, 15 years that she had her problem, they had told her to cut out caffeine, cut out chocolate. Really, a few other dietary things. That was about it. And she said cutting out that stuff initially helped a teeny bit, but it just kept getting worse and worse and worse over the years. Finally, he told her,
it's so easy.
So finally, he told her you have to have a bilateral mastectomy. So she comes to see me. She's got that mastectomy in 2 weeks. I do my exam. I sit down with her and I talk to her about the iodine deficiency continuum. And I said, cyst, hard and nodular, hyperplasia. I said, you're somewhere over here. So I said to her, iodine can work. I've seen iodine treat fibrocystic breast disease really, really well. I said, I believe iodine will work for you. However, you got to give me 3 months. You got to move the surgery back. And if you're not any better in 3 to 6 months, then you might have to do surgery because it's been so long. Because I don't know if I can reverse it. I know I can stop further progression of it. So she went on iodine. She called me up 2 weeks later and said she feels better. Her breasts are 50% less tender.
15 days. 2 weeks.
2 weeks. The shower doesn't hurt her now when the water, hits her chest. And I see her in the office 4 weeks later, and she's now able to wear a bra for the first time. I did another exam on her, and now she's still got all the bumps, the fibrocystic bumps, but the plastic hard punching bag feeling is gone. It feels like normal. It doesn't feel normal because she's got the bumps, but it feels like human tissue again.
Dr.
So
David,
the next 4 months, it was 4 to 6 months. I would see her every month, do an exam. It was better and better and better. And then around 6 months, I couldn't feel the cyst tissue was gone.
Yes.
And she's wearing normal clothes. She can wear tight clothes when she wants. She can wear a bra when she wants. She can wear a bathing suit now. And she goes back to the University of Michigan Fibrocystic Breast Disease Clinic, and she canceled her surgery, of course. So she goes and sees the chairman of the department, and he does an exam on her. And he used the same verbiage that I used to her, because what I used to say to her was, I kept saying to her every visit over those months, it feels like you've had a breast transplant. Like you went from plastic, fake, alien tissue to normal human tissue. So he said to her,
different.
She told me in that 6-month visit, he said, it feels like you had a breast transplant. And she said, that's just what Dr. Brownstein said. He said, what did you do? So she starts telling him, and she said he looked over her, he was looking at her eyes, and then he looked over her eyes as she was talking like he wasn't listening. And then he waited till she took a pause, and then he said, okay, I'll see you back in 6 months. And he didn't ask anything. She had brought a book for him. She brought my iodine book. And she said, will you read this? And he said, no, I'm too busy. I'm not going to read it. So she never went back. And so I was seeing her, and our history together has got to be 20, 25 years now. She's about my age. So we've kind of grown up together. And about 3.5 to 4 years into treating her, she calls me up and she says, it's not working anymore. My breasts are hurting. I'm starting to get the lumps again. And I'm like, Marianne, that's really unusual. I don't hear that's the case from my other patients. In fact, I've never heard that. I said, are you still taking the iodine?
No.
I know. What I said was, how much iodine are you taking? And she said, she pauses, and there's a long pause.
That's why. Can't pause. No.
Forgot to take it. I said, how long have you forgot to take it? She goes, at least 2 months. I forgot to order it when I ran out.
Too much. Can't do that.
And so 2 months later, she starts to get her mild pain back now, but she starts to get her lumps back. Went back on iodine, and it went away. So I will call that a double-blinded, controlled study, because I didn't know she wasn't taking the iodine. She didn't know she wasn't taking the iodine. And then she went back on iodine and it went away. So that's my double-blinded iodine study for cancer.
And endometriosis, have you had any case of endometriosis like this, endometriosis?
So endometriosis, if you fibrocystic ovaries and endometriosis are very common problems. And my experience with fibrocystic ovaries, fibrocystic ovary disease and endometriosis is the same thing. Here's normal tissue, cysts, nodules, hyperplasia, cancer. Those diseases are somewhere over here. And if you catch them early with iodine, those diseases resolve very quickly and without issue. If you catch them really late, when they've been going on for years and years and years, and there's endometriosis all over the gut and uterus, and the ovaries are just packed with cysts, you can stop the progression this way of that, but sometimes it's hard to reverse that. But again, endometriosis, fibrocystic ovaries need to be treated with iodine as part of a holistic treatment regimen, with detoxification and correcting that iron deficiency, correcting, vitamin B1, B12, vitamin C deficiency. Vitamin C deficiency is so common. I can't even tell you. I check vitamin C levels on people all the time. Scurvy is alive and well in the United States of America. I can tell you that. And, our requirements for these things, because of our exposure to all these, these things, all this electromagnetic radiation,
those blue lights and lack of sunlight is very.
So our requirements for these things have gone up over time, and as food gets more and more processed, your food's better than our food. Our food's a disaster, and hopefully we'll change things here. But the typical American food's a disaster, and I don't eat like that, and my patients don't eat like that. But
yes, I know.
It's just a mess.
Dr. Dave Brownstein, adenomyosis could be the same thing as.
Same thing. It can. I've seen that go away when it's not too far down this pathway. Otherwise, you can keep it from growing bigger, with iodine.
Okay.
But sometimes people need surgery when it's so big and such a mess. It's almost. I give the analogy to a kid who's had repeated tonsillitis, and they're just a mess. These tonsils are a mess. And if they go to surgery and get the tonsils taken out, all of a sudden they start growing again, and they're
Yes, I
healthy
have
again.
a student
And,
with that is with this tonsil mass.
it's just if you let things get to that point, sometimes surgery is needed for that stuff. But what we don't want to do is get to that point. And if we keep iodine levels at a young age through all these changing years of life, this stuff won't happen. That's been my experience.
And things get worse with age because iodine project shows that iodine deficiency is worsened by decade, especially in women.
Our iodine requirements now are higher than generation 2, 3, 4, 5 generations ago. We are more iodine deficient now than we were then, and we're suffering from it. We're suffering from breast cancer, prostate cancer, ovarian cancer, uterine cancer, pancreatic cancer. You guys are seeing all this pancreatic cancer that's come out of when I was young and in my training, I saw pancreatic cancer. You know who I saw it in? Drug abusers and alcoholics and old people.
Really?
Now you see it in people. You see it in people in their late 30s and 40s. And prostate cancer in men in their late 30s and 40s. I went to a funeral for a breast cancer patient in her late 20s, diagnosed at 18 years old. We never saw this. Never saw this before. And it's because of iodine deficiency, it's gotten worse over time.
Yes. And how much do you think it's for us that are already sufficient in iodine? Because I'm taking 8 to 20 drops of Lugol's since January.
What percent Lugol's? What percent Lugol's?
5%.
So 8 drops is 50 milligrams.
50 milligrams. I have this too. I used to take it. It's 50 milligrams. Yeah. And now I'm taking the liquid because this is here in Portugal is very expensive for us to buy.
Right, it's much cheaper to
do. I have Lugol solution 5%, and I have daily 14 drops of 5%. 14.
So the work that I did with Dr. Abraham, who was my mentor in iodine, we looked at differing amounts of iodine, and what I find with most of my patients is, for an adult, that if they're healthy, without thyroid disease, breast disease, ovary, uterine, pancreas, and without big glandular diseases, that around 25 milligrams to 50 milligrams is enough for saturation.
4 to 8 drops, kind of.
Yeah, somewhere around there.
All right.
However, if they have glandular disease, particularly glandular cancer, they need more.
More.
How much more? 100 milligrams, 200 milligrams, sometimes 500 milligrams.
I read this in Iodine Project.
As part of a holistic treatment regimen.
Yes.
With salt. Salt's really important to take with iodine because salt helps you get rid of the toxic halide, bromide.
Yes, the receptor.
And iodine increases your requirement for salt because it increases your metabolic rate. And you need sodium to run all these reactions to make more ATP molecules and to get iodine inside the glandular tissue.
Yes. And do you think we have to take all these nutrient supplements together along with all the time long we have, because the supplementation of iodine is for the rest of our lives. And
I think if you stop iodine, it's iodine. We're not camels. We don't have humps of iodine that we can store on when times get deficient. So we utilize iodine on a daily basis. There's no store of it. So if you stop iodine within 48 to 72 hours, you're going to drop the levels down to a deficient level. If you're taking in a deficient diet, it's quick.
Yes.
So iodine needs to be taken, and particularly with the world we live in, with so much bromide, so much fluoride that's just out there. And, and I also think that this EMF, all this electromagnetic stuff that we're getting.
Pollution, electric pollution.
Has increased our iodine requirements. Yes. And so I don't think.
Interesting you're saying, because you're making a relationship with the environment with excess of blue light, lack of real sunlight, and the lack of iodine. Very interesting, this. I think that's what we are living today. This is a problem. Everybody is so sick nowadays. Everyone is sick because I think mitochondria is very vulnerable in this environment.
Absolutely. Mitochondria are very sensitive to nutrient deficiencies and toxicities. And in the work I did with Dr. Abraham, we showed in some people just taking iodine created a chaotropic effect. It's spelled CHAOTRPOIC. A chaotropic effect, because we don't know the mechanism of it, means to displace. And it caused mercury, lead, arsenic, nickel, cadmium to come pouring out of people, when they took iodine. Now, this didn't happen in everybody, but it happened in a substantial number of people, and a substantial percentage of people.
Yes, so especially those who made a chemotherapy. People that made chemotherapy and start using iodine, they have very, very strong Hersheimer reactions.
Absolutely, I agree. And salt and vitamin C help to buffer that.
Yes, I teach this to my students. See, people. Fantastic, Dr. David Brownstein. One thing I think is very, very problematic nowadays because of Wolff-Chaikoff effect and Jod Basedown. People of the science don't allow the studies, articles, peer reviewers don't peer review studies with 50 milligrams, 100 milligrams of iodine.
Medicine's never been easy to change. And are you aware of the story of Semmelweis? Dr. Semmelweis? He was from Europe.
I'm not sure.
So Dr. Semmelweis was in Europe, and he, in the 1800s, mid-1800s, he was working at two hospitals delivering babies. And in one hospital, the mortality rate for women who were delivering babies was, how high was it? It was 10 or 20-fold higher than the other. He worked at a public hospital and a private hospital. In the public hospital, women were dying delivering babies 10-fold higher. I don't remember the exact number than the private hospital. And he tried to figure out why. Why are women dying so much over here and not over here? So he finally ascertained that in the public hospital, doctors were. This was before germ theory.
No, I know this story. It's very interesting. Yes.
So doctors were delivering babies after doing autopsies, and they would do an autopsy, not wash their hands, go deliver a baby, and the mother would get sepsis and die. Much higher rate than the private hospital where they weren't doing the autopsies. They didn't wash their hands there either. So he put a study together where he put buckets of lye between the beds in the public hospital, had doctors dip their hands in the bucket of lye before they delivered the baby.
Yes.
And all of a sudden, the maternal mortality rate in that hospital, private hospital. We said he wrote an article and started lecturing for delivering babies. They were transferring something from the dead cadavers to the babies. They threw him out of the hospitals. He never delivered another baby. They put him in a mental institution in which he died a few weeks later. And it took doctors 40 years to wash their hands. And countless numbers of women died from this lack of washing their hands. And a simple thing like that we take for granted now. And I'll tell you, it's the same thing with iodine, same thing with vitamin C. It's the same thing. Doctors don't want to change. Doctors are lazy. They don't want to learn nutrition because they don't learn it in medical school.
Yes.
And because they don't learn it, they think it doesn't exist. And I was there. I used to think like that. I don't anymore.
It's very, very problematic, and that's why I charge very cheap my course, because I want everybody to do this and start to pressure the doctors, and it's already happening. Doctors with more open that are more opened, they are now doing the course. I have lots of doctors here in our audience, and they did the course, and they start to use the protocol with their patients, and it's been amazing. We have now a list of many doctors that are doing the protocol with their patients.
That's fantastic.
Yes. So, Dr. David Brownstein, I won't hold you too much here because it's almost the time for us to end. One more question that the people are asking here about tooth amalgam, if it's dangerous to use Lugol's with amalgam. I didn't notice anything, but what are your thoughts?
So Dr. Abraham and I looked at that as well. And what we found in many people, that simply using iodine allowed the body to start getting rid of mercury that's been stored up in fat tissue and nerve tissue, probably in fat tissue and nerve tissue. And the most common source of mercury, number one, if someone's got amalgam in their mouth, it's amalgam. Number two, it's eating fish.
Fish. In Portugal, it's fish. Portugal, people eat lots of fish, very mercury in the fish.
The oceans are polluted with mercury, and the fish are polluted with mercury. So you could take iodine with amalgam, and I said iodine is part of a holistic treatment regimen. Part of that holistic treatment regimen is detoxification, identifying toxic levels of metals like mercury, getting amalgam out of the mouth, and then detoxifying from that. All the while taking iodine. Yes, you can take iodine even if mercury is still in the mouth.
I used to put things I learned with Judy 2. I put on an empty capsule, capsule. I put Lugol's here, and doesn't touch my amalgam. And I think and my amalgam, I'm using Lugol's for 8 months. It's intact.
Amalgam is more likely to release mercury when you're eating hot food or hot liquid versus
yes.
So yes. I have not found mercury levels going up from someone taking iodine, even drinking Lugol's or taking iodine pills, versus doing what you're doing. When either way is fine with me.
Okay. So good, Dr. David Brownstein. I'm so happy to talk to you all this time. If we could stay here for long hours talking about this, and I think for you too. Thank you for transforming so many lives, and most of all, thank you for putting all this knowledge available in your book, in videos, to teach people and to spread this knowledge. It's very important knowledge to be spread. And I know your family is working with you, because I saw in your website that your family is working with you too.
Two daughters who are doctors working with me. I'm having the best time of my life with that.
Oh gosh, it's so good. I'm so glad to hear that.
People ask me, when are you going to retire? Your daughters are working there. I'm like, why would I retire? I'm having more fun than ever. I'm not retiring.
I understand. It's so fascinating to see people improving their health with so simple things like lifestyle, isn't it?
Oh, I have the best job in the world. I'm honored to do it. It's a pleasure to go to work every day, and I feel like I'm doing what I was set out to do. This was my chosen. I chose the path, but this path was chosen for me, and luckily I found it. And so when I was doing regular medicine for a short period of time, I did not like that. That was not.
I figured.
What I consider good medicine.
Yes, this is good medicine. I think this is medicine, and I used to say that there is no medicine without iodine, because iodine is behind every condition, health condition.
It's funny when I do lectures. I do lectures for my patients once or twice a year, and I always say you have to do the basics. The basics are: you got to eat good food, you got to drink water, you have to exercise, and iodine is one of those basics. And the fifth basic is salt.
Yes,
those 5 things have to be done, or you're not going to have your optimal health.
Yes,
that's not the only things you need to do, but those are the 5 things that have to be done.
And if you do this basic stuff, probably you're going to have solved 80% of any health problem.
Absolutely. And I tell everyone, well, they're listening to me. I see all the nice notes I'm getting, and I can actually pick out the nice notes in Portuguese as well, because I.
Oh, really? What did you pick up here?
Well, because I see some words that I'm pretty sure are positive words. I don't think they're negative words. I don't think anyone's yelling at me. But a lot of nice things people are saying in English, and I appreciate it.
Yes, they are saying English here. Really, really. Also, I'm so glad. People are very grateful you're here with us, sharing your knowledge. Because in Brazil, we have so little information about iodine. People don't know nothing about iodine. I'm bringing this to Brazil, and you're here. It's very, very important for us. Thank you so much, doctor. And we'll talk later. Who knows?
We'll talk later. When I come to Portugal, we'll meet in person. And,
please come here and have a coffee here.
That's where I want. That's one of the places I want to go visit in life.
Yeah, it's fantastic here. Have a coffee, not tea, because tea. Dr. Elizabeth Bright says there's one bag of green tea. There's 6 milligrams of fluoride.
You know, I don't drink tea for that reason. I agree with
No,
that. I'll have water. I'll have nice water.
Yes, with salt. We have great salt here. Great salt here in Portugal.
All right.
Very cheap and great quality. Yeah, I will show you. Thank you so much, doctor. Bye-bye.
Take care. Bye-bye.